Everyone, today I demonstrate the fetal skull. The fetal skulls consist of the 7 bones, 2 frontal bones, 2 parietal bones, 1 occipital bones and 2 temporal bones. So, the sutures. There are the frontal suture which is present between the 2 frontal bone, and coronal suture between the frontal and parietal bone, and sagittal suture between the 2 parietal bone, and also the lambdoidal suture between the parietal and occipital bone, and also Wama suture between the temporal and parietal bone. Then discuss about the frontal. There are the 2 frontal. This is the anterior frontal and this is the posterior frontal. Anterior frontal also called the bregma. This is diamond shape and bounded anteriorly frontal suture, lateral side coronal suture and posteriorly sagittal suture. This is diameter is 3 into 3 cm and this closed in 18 months. Then in posterior frontal, this is the triangular shape and also called lambda, and this is diameter is 1.2 cm into 1.2 cm and this is closed in the 6 weeks to 12 weeks. Then area of the fetal skull. There are the 4 areas: face, brow, vertex and occiput. Face extends from the supraorbital ridge means glabella to the mentum. This diameter is called face, and the glabella to the posterior part of the anterior frontal. This part is the brow, and from the anterior frontal to the posterior frontal, this part is called vertex, which is the extends within the parietal eminence. Means this part is called vertex, and occiput from the posterior frontal to the foramen oval, this part is called occiput. And then diameter of the fetal skull. There are the 2 type of the diameter. One is transverse diameter, one is anterior posterior diameter. In the anterior posterior transverse diameter, biparietal diameter. This is the distance from the 2 parietal eminence. This diameter is called biparietal diameter, which is 9.5 cm. Then super subparietal diameter means 1 point above and from the parietal eminence and 1 point below of the parietal eminence. This diameter is called super subparietal diameter, which is 8.5 cm. Then bitemporal diameter. Bitemporal diameter from the anterior inferior end of the coronal suture. Between 2 anterior inferior end of the coronal suture, it is called bitemporal diameter, which is 8 cm. And then bimastoid diameter, which is the smallest diameter of the fetal skull between the 2 mastoid tip or mastoid process. Means from this to this mastoid process. This is called bimastoid diameter. Then anterior posterior diameter. There are 6 anterior posterior diameter is present. First, mento-vertical diameter. Diameter between the mentum to the highest point of the sagittal suture. This is sagittal suture and highest point of the sagittal suture is this. So, this diameter is called mento-vertical diameter. This is the largest diameter, which is 14 cm. Then submento-vertical diameter. Submento-vertical diameter between the junction floor of the neck and mouth to the highest point of the sagittal suture. This diameter is called submento-vertical diameter. This is 11.5 cm. Then submento-brachmatic from the floor of the neck and mouth means this to brachma. Midpoint of the brachma or anterior frontal, this is called submento-brachmatic diameter. This is 9.5 cm. Then occipito-frontal diameter. Occipito-frontal diameter between the occipital eminence to the glabella. Means this to this point is called the occipito-frontal diameter. It is the 11.5 cm. Then suboccipito-frontal diameter between the nape of the neck and anterior part of the anterior frontal. Means nape of the neck to the anterior part of the frontal. This diameter is 10 cm, which is called suboccipito-frontal diameter. Then suboccipito-brachmatic diameter means nape of the neck to the midpoint of the brachma. This diameter is called suboccipito-brachmatic diameter. These all the anterior and transverse, anterior posterior or transverse diameter of the fetal skull.